Hi, I'm Dr. Sattvika, and if you are worried about the excess weight you retained after pregnancy and childbirth, this video is for you. Join me to learn the best way to get rid of postpartum weight safely and effectively without compromising your health and your baby's nutrition. What is postpartum weight? You already know the answer to this. It is the weight gained during and after pregnancy. So, what causes this weight gain? Several factors. Weight gain during pregnancy between 10 to 12.5 kilos is normal because of the growing baby in your womb, the retention of amniotic fluids, and your body's attempt to store fat and prepare for the childbirth. Not gaining adequate weight during pregnancy may increase your risk of premature childbirth. But do you know that nearly 48% of women gain more than the recommended weight during pregnancy? It is important to remember that women undergo not one but several physical and hormonal transformations during pregnancy, which explains the postpartum weight retention. And not to forget the challenges of baby care. Let me tell you some common reasons you may retain or gain weight post-pregnancy. Postpartum thyroiditis. If you gain weight after a baby, it could be due to hypothyroidism. It also causes fatigue, constipation, irregular menstrual cycles, and muscle cramps. This generally subsides naturally, but it can hinder your weight loss efforts if you don't seek medical attention immediately. Diabetes. In case you have diabetes after pregnancy, it can cause weight gain. Preeclampsia. High blood pressure during pregnancy can lead to water retention and weight gain during pregnancy as well as even postpartum. Postpartum depression. This is one of the many side effects of hormonal fluctuations after childbirth. It may cause low energy levels, irritability, anger, and insomnia. It can also trigger poor eating habits and contribute to weight gain. Poor lifestyle habits. Taking care of a newborn is challenging and leaves new mothers no time and energy to follow a fitness routine or weight loss diet, leading to weight retention or maybe even weight gain. Now that we know the causes, the next question naturally is, what is the best solution? First, remember that everybody is unique. A universal weight loss solution or crash diet will not work. You may have heard, no two pregnancies are alike, right? Your postpartum weight depends on the type of delivery you had, any health complications you may have experienced during your pregnancy, your BMI at conception, dietary habits, and physical activity levels, and the time your body needs to recover from childbirth. While some new mothers recover quickly from childbirth and can kickstart their weight loss journey immediately, some may need more time to cope with the postpartum physical changes. Both approaches are acceptable if you do not take undue pressure and compromise your health. However, your doctor will recommend dropping down to your pre-pregnancy weight 6 to 12 months after delivery to prevent obesity and related health complications later on. Most women naturally lose almost half the pregnancy weight within 6 weeks after childbirth. But if you had a C-section, then your doctor will advise a few weeks of rest. Again, this too varies for every individual, and some may recover faster than the others. Once you settle down in your new mommy role and wean off your baby, you can get the best available weight management solutions. Beyond Weight Loss program, designed by qualified experts at Oliva Skin and Hair Clinic, is a safe, scientific, and sustainable solution for postpartum weight management. Our qualified medical experts will assess your medical history during and after pregnancy, your nutritional needs, your pre-pregnancy lifestyle, dietary habits, and family history of obesity. They will conduct a body composition analysis to determine your BMI, basal metabolic rate, waist to hip ratio, body fat percentage and distribution, muscle mass, bone and water weight. They will also check your hormonal status and nutritional deficiencies. Based on all the above information, our experienced nutritionist will give you a personalized meal plan based on your food preferences, health needs, and weight loss goals. You will also receive a custom designed exercise prescription from a certified fitness trainer that aligns with your weight loss needs, strengths, and limitations. Team Oliva will offer you all the guidance and support to ensure that you get fit again. We will closely monitor your progress and revisit the action plan based on your comfort and results to keep you motivated and optimize your healthy weight loss. We will not only help you achieve but maintain your weight goals. So, now you know at Oliva, we ensure that new moms do not feel pressure to lose weight overnight. Instead, we help you focus on building a healthy lifestyle, something that you can teach your child by example. And what can be more satisfying than that? If you too want to be a healthy supermom, sign up for Oliva's Beyond Weight Loss program today. Visit olivaclinic.com or call us to know more. But before you leave, don't forget to like this video and hit the subscribe button for more informative content.